Sometimes when I have to reflect back on the patient's emotions, I struggle at that time. What to say when she suddenly throws an emotion at me, I'm
Hmm.
struggling in thing or that thing. At that time, I get taken aback. I get a bit confused about what to say, how to say, not to be offensive, not to be judgmental. So that is my problem up till now. I can face unseen stations. I can manage them up to borderline. I think I can do that. But the only problem is the reflecting back on the patient's ideas or patient's emotions or anything that she throws at me. Sometimes it comes to me like she has thrown something on me.
Okay, so is that, should that be a problem? I believe if you make a note of such emotions, like,
Hmm.
make a variety search, so have a sketch in front of you, like a big, you know, piece of paper, big sheet, and write various emotions, write various things, okay? And you don't have to do it in one sitting. You have weeks in your exam, okay? So you keep on thinking that what should be, imagine the scenario, keep on thinking, or explore with, in this time, what are the best responses when the patient says these things. So be ready for those emotions. There will be 10 emotions, 12 emotions. There can't be 200 emotions. There could be maybe, okay, maybe there are 30 emotions. Let's see, let's be a bit liberal about the number. But is it not doable? It is, yeah. So all the emotions, if you compile them and you say that, okay, these are the sentences. So by broadly, all those emotions can be divided into, say, happy emotion, okay,
That. Hmm.
sad emotion, angry
Hmm.
emotion, upset emotion,
Hmm.
frustrated emotion, depressed emotion, okay. So these kind of, and all you have to do is be with her. You have to prove to her that I'm your team, I'm on your side. Always, always. It doesn't have to always come with words and, rushing into dealing with her emotion. It doesn't always have to. Just imagine a real person sitting in front of you in your clinic. What would you do? She has a loss of a baby, like maybe she ended up with a stillbirth. What would you do? Would you just keep on lecturing that I'm with you? I would be
No.
sitting quiet with her for a few minutes, like few moments, not
Hmm.
minutes, of course, in the station, but few moments. I'll give her that feeling that I'm holding her hand in. When I'm online, I can give her that feeling still. Okay.
Hmm. Yeah.
You have to really immerse in that feeling. Once you immerse in that feeling, all will come natural. I can assure you. Okay. So sadness, you have to be just quiet and,
And anger.
and you dealt with in like few seconds, like 20 seconds, 25 seconds. You have to immerse. And anger, you have to immediately say that, I'm terribly sorry. I am terribly sorry. This is not the standard that we expect from ourselves. Definitely not the standard. I'd be equally angry if I was in your shoes. I totally understand. I would be equally upset, equally angry if I was in your shoes. Let me make it, let me help you here. Let me sort this out for you. Let's take care of your health and your resentment on this. Let's take care of them both, but let's not, your health is the priority here. Let me help you first in that case.
Hmm.
And I assure you that I will deal with this with all the, we've got very good protocols. We don't just let our mistakes go. We learn from our mistakes. So once you let me help you with your medical condition here, with you help me,
Hmm.
you let me help you with fixing this for you, and I'll assure you, I'll escalate these to all the proper venues. I'll do an incident reporting on this. I'll involve my consultants. We will speak to the people involved and we'll see what happened, how it happened. And there is a very rigorous process here. And I can assure you that the management will get in touch with you. They will give, once this is investigated, they will meet up with you. They will meet up with you. They will explain what happened. They'll formally apologize, and we'll do everything we can do. And I'll also give you PALS details as well. Okay. Some people keep saying things about that PALS is not, if patient is not asking, then you don't give PALS details. That's an absolutely insane idea, that you keep waiting, that patient will say.
That's what I heard, that you don't have to tell them yourself. Wait, if they
That's
ask
absolutely insane. Okay, that's absolutely insane. Why is it? Because you have to disarm the anger of the patient. You have to disarm, okay? If you're not offering, so there are two situations when you'll give PALS, okay? One, when the patient is saying that I want to complain, definitely you'll straight away give her. Two, when you see that the patient is really upset, you have done step by step, you have first of all apologized and said, I want to take care of your physical well-being, as well as I want to address this. I want to write an incident report and all that. And you see that continued, she is stressed and all that. You will then say, and even if she's calmed down, then by then you can see whether, it's a good idea. I will always add, okay, I will always see that I have given her this. And when I say that there is an option of, if you are not happy with this approach, if you see it doesn't, it's not going in the way that you wanted it to go, I'll give you PALS details now. Whenever you decide, you can, you can get in touch with them. That's an independent service, and that's, that for your utmost we want your utmost satisfaction. So you are actually saying, I'm on your side. So if you are giving to her, she may be simmered down so well that this doctor is definitely on my side. She's providing me with all these things. She's not defensive. She is not hiding away. She's not running away from the mistake of her colleague, of herself, or, of her senior. So she is very much reassured and happy. So this is disarming somebody's anger. You don't start with saying, okay, go to PALS, but you definitely, a stepwise fashion, if she was here in her anger, you slowly, first, I'm looking after your health. First, acknowledge her anger and say, I would be equally angry. I'll be equally upset. I understand. And then you say, let me look after your health. I will do the incident reporting. So we're one step down now. Let me look at, first step was match with her emotion, that yes, I acknowledge your emotion. I respect your emotion. Next step is you say to, let me look after you, sir. Let me sort your health out. Next step, I'll do incident reporting. And then she would have simmered down so much that you say, there is always PALS as well. If something doesn't go the way you wanted it to go, there is an option of this independent service. Okay, I'll give you the details as well. And she would, by that time, she'd be very friendly and all that, and she'll start talking to you in the way. So this is how you handle. So please don't think that PALS means that you have axed your feet. It's not like that. You have disarmed the patient's anger, basically. You made her feel you are her team. Okay? Yeah.
Okay.
Yeah. So any other emotion, just Falak, please keep writing down. Okay. Keep writing down that, how do I tackle? And then you will come up with, hi, Pooja. Yeah, sure. Pooja, do you want to ask something? Yeah. Please, you don't have to raise hands, just jump in. We are few and we can talk like friends.
Yeah. So how are you doing? All fine?
Good. Alhamdulillah. How are you?
Yeah, I'm all okay. My question is that there is one station of PMS when the patient is taking POP, and when we address that POP is going to increase your symptoms, that's why you're having this symptom. Then normally a role player says that why my GP did not inform me about it. Then what should be the reply?
So you would say, you first of all, you'd say, ask her whether you had symptoms at that time, because POP doesn't cause symptoms in all the patients. Okay, it's a suitable option for so many, situations. So although I wasn't there when they, prescribed to you, and I'm not aware of what they would have explained, but if they haven't, were you having these symptoms at that time when they started it? And and you can apologize. I'm sorry if it happened like that, because there's no harm in saying I'm sorry. Sorry is not an admission of guilt. You always, first of all, come at level with her feelings. Say, I'm sorry if it happened that way. And probe more into, so when did he start that? Were you having those symptoms at that time as well? Do you think you mentioned these symptoms to him? Okay, I'm more than happy to check with him what happened at that, and he didn't inform you. What was the reason behind that? We are always happy to explore that for you. Okay, I do apologize, and take some, and then she will quickly come out of it unless she has lots of anger against him for any reason. Okay, and we know that. We'll just say that maybe you didn't have these symptoms at that time, and that's why you didn't mention. And not all the women suffer from these symptoms, so apologies if it got missed for some reason. So do you think it's okay, or do you think there will be still problem?
I'm not sure, because I tried to reply the same way. Somehow my mentor was not very happy with my reply, because I took almost 1.5 minutes to explain this. That okay, this and that. So I was thinking, how can how can we cut short it, because we have to address this concern as well, because we are addressing it as okay, because you are taking POP, so that is you are getting more symptom, or you might have
tell you
started
one
because
thing. I can tell you one thing. Let me pause this for a second.
Can I try how to reply this, Sam? Can I try once after listening to you?
Yeah, please go ahead.
Can I say that way, that I'm sorry whatever has happened? Normally we explain all the side effects.
First of all, I want you to immerse in the emotion. Your sorry should sound like a sorry. Okay?
Okay, sure. Okay. Sam, I'm so sorry that has happened to you. Normally, we explain all the side effects to all the patients, though it is not necessary that all patients are going to have all the side effects. I cannot comment on that, but definitely I'll discuss with my consultant.
Pause, Pooja, pause.
Dr. Sam, can I try?
Let Pooja finish, and then all of you can try. I don't mind. But what I'm saying is, take a really natural pause as well. So start again, Pooja, restart. Please.
Okay. Sam, I'm so sorry that has happened to you. And we normally explain all the side effects to all the patients, though there is a possibility that not getting side effect to all the patients. Sam, I cannot comment as of now what has happened actually, but I'll definitely talk to my consultant. She may look into the matter and we'll come back to you with the results. Is it fine for you?
Yeah, okay. Maybe I didn't have those symptoms at that time, so maybe, yeah.
Okay, sure.
So, okay, again, I'll say, whenever you're saying one aspect, just try to give it a pause. Let her nod or absorb that thing. Let her agree with you, and then you can say. So don't rush into your next sentence. You're still not giving enough commas there. Okay. Another thing is, she's saying that it was the GP. So you don't need to talk to your consultant for what GP did. Okay. So you can say, I'm happy to write to your GP. Just, so he when you see him next, he'll be able to probably look into it, what happened, and he can explain it to you. Okay.
Okay. Yeah. Okay.
Be sound sincere, look sincere. They're looking at your eyes. Your eyes are very expressive, yeah?
Mm-hmm.
Yeah, so eyes have to be expressive. You have to make them believe, because they're online. You need to make them from your sound, your throat, your eyes, your expressions. You have to make them. If you are immersed in the situation, that they will, understand. Okay, Falak, you want to try?
Yeah, I want to try. I'm sorry, Sam. I'm not sure whether your GP did address your concerns at that time or no. I'm sure he should have addressed your concerns, but what I
I'll
will,
stop you here. I'll stop
yeah,
you here. So you are basically saying that no, you are not. You're not. You are wrong. You are what you are saying cannot be right. So try to be more bureaucratic, more
okay,
okay.
okay, okay,
So I
okay.
let me be the patient. Okay.
Mm.
So doctor, if this pill has so many problems, why did my GP not tell me when he was prescribing?
I'm so sorry, Sam. I'm not sure what happened at that time, but in order to look into it, I will communicate this to your GP and I will write back to him to know what happened at that time. And then I'll surely get back to you and tell you whatever we had a communication about. Does that sound good to you?
Okay, all right, yeah. I'll see him anyway, so I'll check with him. Okay.
Mhm.
Thank you. So, what you have done here is you said, I will write to him, I'll ask him, and then I'll tell you. But she is closer to her GP than she is to you, or than you are to her GP. So, her GP is her first point of contact. Like he's her first rishtedar, if you want to put it like that. Okay.
Mm.
So, she will. You can say that I will write to your GP when you next see him. He will be able to explain you better. Yeah.
But were my feelings, was I able to put in my feelings? That's what I was trying to do. Actually, I don't know the answer to the question, but I was trying to put in the feelings. Was I able to do that?
Yes, you were, I would say, but still you can improve that. Okay.
Mhm.
So you want to be that patient and then let me try it with you.
Yeah, I can try that. Yes, we can try that.
Okay.
So, doctor, I told my GP about my symptoms at that time, but still, I don't know why he did not listen to me and still gave me these medications that are causing my symptoms. So, can you tell me why he did like that?
Oh, I'm sorry to hear that, Falak. I'm really sorry. I can't think straight straight away why he wouldn't have done that. Oh, we can always ask him. Sorry if it happened like that. Okay. Were you having as severe symptoms as you're having now? And
No, at that time, actually, I was not having severe symptoms. They were mild. So, I'm not, I think I did mention to him, but I'm not sure.
yeah, okay. Could be that you didn't mention, and because this drug doesn't cause problems in all the women, he may have either kind of mm, told them in a way that he couldn't have highlighted them enough to you. Maybe it happened that way, or maybe it was a mistake, an error. So I'm happy to write to him so that when you see him next he can explain that to you. Would you be
Yeah,
okay? And we can
that would
stop
be
this
great.
medication now. I can write you the other medication that's more suitable. Yeah.
Okay,
Would that
that
be
sounds
okay?
good to me.
Yeah, okay. I will
Okay,
do that. Sure, Falak. We'll do that. We'll try to help you with that. Okay.
thank you
All
so
right.
much.
So does it sound convincing a bit?
Yeah.
Yeah.
Mhm. Mm.
So I'm giving, so Pooja, did you see that I was giving pauses? Okay.
My one more question, Sam. Can I
Mhm.
call you Sam? Is it fine?
Yeah, sure, please.
Yeah. Sam, one more question that while talking to role player or the patient during our exam, are we supposed to be like what I'm trying to say that as when you were talking, you were just like giving some I would say some how to express this, some movements of your body, and like normally as we see in foreign movies, that Hollywood movies, they talk that way only. If we see our kind of movies, if we see their kind of movies, so they talk differently. Our as a doctor, we doctors should talk that way only, because
Well,
you were talking that way. You were talking that way.
so what I always say to my students as well, do in Rome what Romans do, okay? So, and do in UK exam what UK people do, okay? So yes, I would say yes, please, yeah, okay? Because that just makes you sound sincere, okay? You can't be bland and sitting like that, what did you, why it happened? You have to be, sound sincere, yeah?
Whenever they see their movie, they always like, yeah, okay, is that so? Like they make they behave this way. Normally, we don't do in our like countries. No?
Yeah, I get that. But we in UK, we are very much like, we develop that personal relation in that way, like a partnership relation with the patient. So this is a partnership where we are empathetic. We come to their level and we understand. So I'll give you a little example here. Maybe you'll be able to understand how it goes in UK. Okay. There's an OSCE for, say, junior doctors, okay, a simulation station, okay. What they're doing is that a mother is sitting on a chair, okay, and she has her baby and she's concerned about the baby. Now, you know how this F1 doctor will come in, or F2 doctor, they will come in and the nurse will say that, can you address this concern of the mother? The person, the doctor, woman or man, whoever, male or female, the doctor will approach the mother. Now the mother is on the chair, sitting on the chair. There isn't any other chair there, okay? And they start talking. Now we examine 4 or 5 students, and do you know, 2 or 3 of them did better than the others in terms of when we were counting everything else. You know what was the most important thing that was highlighted? Those people got more marks who actually sat down on the floor with their knees on the floor to come at the level of the mother, because she was sitting. You can't be standing and talking over like this to the mother. We are that much sensitive to the, how is the patient or the parent perceiving about us. So the doctors who sat down with the knee on the floor and, sat down like this and came to their level and started talking and reassuring the mother, they got a big pass. Okay. So do you get my point here, Pooja?
Exactly. And my second question, how to dress up? Because my previous mentor told me, just don't wear anything, just tie your hair, wear something very straight, white color or something plain, and like don't wear any jewelry or something. So how does it there?
Well, I can tell you, it's very unusual that I'm not wearing my chain today. I normally have a chain, and I had my chain on the day of the exam as well. Okay, so that's not a harm. The top, it was white. That's correct. I liked it to be light. Okay, so there's not a hard and fast rule. Some people, they are very much into black stuff, all offish formal black. I'm not that kind of a person. If I didn't have a pure white top, I would have probably gone for a very light color. Okay, so that just to make things appear a bit, decent and natural. But yeah, please feel free to have your chain in that's absolutely fine. Just a normal touch that you have is absolutely fine. If you don't want to, that even is absolutely fine. This part is going to be visible, okay, this much. If you are nice and like a nice color, which is not too much of floral patterns and too much, it may be even to be honest, if I didn't have a choice and I had to wear something floral and something like that, or maybe I thought that the floral colors are much lighter and better and my screen image is coming better, I would go for them. To be honest, it's how you wear what you want to wear. Okay, if you have 2 or 3 things you can wear, and look at come in front of the screen, put the cam on and see how you feel you look. Okay, so you can do a dress rehearsal. Absolutely, I go with that idea. Okay, so you can do it a week before or 2 weeks before and see, okay, this is looking a bit calmer. You want to look calm and decent person, and then you can go with whatever. Okay, I wouldn't recommend many, kind of bubbly things coming out of your shoulders or something of, designs or, it's just simple. Some people wear the formal kind of a bit of jacket on the top, even that's fine, but not wearing is better because it's all day and you have to be comfortable as well. Okay, so but you can choose to wear or not wear a jacket, absolutely fine. Okay. Should not just not look like that you are, you just ended up cleaning your home and you're now coming in front of a camera and sitting and doing the exam, not looking too informal. That should be fine. Same applies to our friends who wear scarves, just tidy and nice and all that, and that should look absolutely fabulous. Okay.
So my third question is that in UK they have any fixed ban for like allergies and different things? If we are mentioning about the allergy, are we supposed to mention that they will give you the red band or something like that during your
Yes.
admission? Is that so?
That's a good idea.
Red band, yeah. But you don't mention it to the patient in the station.
But we cannot.
No, it's not about cannot or should not. It's about somebody telling you, if a patient comes to see me in the clinic and she has allergies, I don't tell him that when you come, I'll give you a wristband. No.
No, if someone say come with the antenatal care and we are going to admit her, we are going to discuss about her birth plan. So keeping that in mind.
No, we don't
Because she
say
might
that. That says, look, that's something we give wristbands to patients as their identity. Do we talk about them? No. We do so many things. Do we talk about them that, we'll do this? I think this is look, you have to remember one thing. There is this education is like a business, and it sometimes becomes a dirty business. Dirty business means somebody will pull up anything from UK that they know and they will throw it onto you, and they will try to make you feel that you didn't know this thing. This is very important and you should mention. It's not something that we mention that will give you a band. We don't say that. We admit people all the time, like in antenatal, for birth plan, from triage, from everywhere. We talk to them. We don't say, I'll give you a wristband for your allergy. Okay. It's not that you will get a marks deduction. You won't. You can say that, okay, if she has mentioned allergy, you can say that, yeah.
But it is not going to grant us some marks as well. It's not going to help us.
It will sound very strange because no UK candidate would have ever said that. It will sound strange that why are you talking about that? It will sound as a foreign thing, okay? That why are you mentioning that? Because there are so many things that we do. So we don't, we don't need to say those things, okay? So again, I don't think it will deduct your marks if you, said it in flow. But why would one say it in flow if one was not saying it usually? Okay.
Okay. Sure. Yeah.
Okay. So it's something like, making you feel that there are some foreign things that you need to push into your preparation. I think keep focus on the clinical side of the things, and these logistics are much less important. There are some things are important, but much less important, these kind of things. Okay.
And one more question, Sam. This is a very, I would say, a difficult situation when we talk about the cancer, and then we ask about the family history of the cancer. Few mentors says that you should always first talk about the history, then explain the report. Few say first explain the report. And the moment we ask, do you have any family history of cancer? So normally they jump up. What do you mean? Why are you asking this thing? It means I'm having cancer. Then again, it becomes very difficult. If I say, yes, you have a cancer, then I have to go for this thing. If I say, you don't have a cancer, then I'm giving the wrong information.
So no, you never have to give wrong information. Okay. How would you? So I am very much a proponent of break the news first. Okay. I think a lot of emotional exploitation takes place when you keep talking about chit-chatting about other things, and then in the mid or towards the end, you're telling her the report. I think that's very cruel. Okay. RCOG does allow both ways, but when they allow both ways, they don't mean that you can be irrational, and people go irrational. I've heard so many stations of people making various audios on breaking bad news. They go irrational. They end up with emotional exploitation, and I'll tell you what I mean by that. For instance, if it was if they're asking and everything is going fine, they're saying, okay, so how is that, and she's happy that doctor is asking me all those things which are going fine, and she's coming in that state of mind, all good, all fine. But even this is more obvious in cases when it's actually a molar pregnancy, and you are asking, was it a planned pregnancy, and was it, and she's smiling, she's, yeah, I'm so happy and all that, and that then in the end you are telling, or in the mid you are going to say to her that it was actually a molar pregnancy. That is exploitation, that you made her happy initially, or let her express her happiness, and after some time you are kind of disheartening her by this giving this news, or if it was a miscarriage again. So for me, the first and foremost is that I don't think people are very much skilled in dealing with this. So if you have to tell her, suppose go this way, that BBN later, history first, then you need an utmost level of expertise in how would you not let her go in that happy direction, and she will not feel so broken-hearted then that, oh my God, I was saying, oh, we were excited. I have actually heard stations of people who, when they keep saying that, oh yes, we are very happy with this pregnancy and all that. So why would you want to hear these kind of things if you have to break the bad news? So please break the bad news if you want an easier way. Easier way is BBN first and relevant questions later. Otherwise, you keep on asking irrelevant questions, go on with that monotonous history that you're used to, that wastes your time. You have to remember one thing, please. When you do BBN, there are questions that the role play will ask relevant to that. If you waste first 3 or 4 minutes in asking her history, and I keep saying that, emotionally exploiting her in that way. So how would you answer all her questions? So you can always ask questions later on, okay? BBN first is helpful if you want to present, if you want to say that, give me examples that how would we do in this, how would we, you can ask me and I can give you example kind of framework how to go about that, okay?
Okay, Sam, normally what they say if you like going to breaking the bad news first, then they will keep on crying and
they are covering up their weakness. That's not true. Okay, the role player will only keep on crying if you're not handling it properly, if you haven't done enough to make sure that she feels safe and she feels looked after and she feels supported. Okay, only then if she's crying, then you're doing something wrong. Look at what you're doing, and um, uh, make your connection again with her by saying something different. Okay, if she keeps crying. So I would, if she has a cancer, this is how I would go, that I will say, hi, how are you today, and all that introduction, and so I see you're here for your reports today, is that right? Did your GP mention at all anything about the report? Has somebody spoken to you about this report? She was like, no, you tell me. Okay, sure, I can talk about that. Do you have somebody with you at all? Is somebody in the waiting area? Or, she suddenly goes like, what's happening? I'm afraid I do have a, you now, depending on if it's hyperplasia or if it's cancer, you can say concerning news, you can say bad news. So I do have news to share that could be a bit too much of a shock. I'm sorry, I do apologize. Do you want my nurse to be with you? And she would then become more panicky and she'd say, tell me, doctor, what happened? So, I'm afraid the results is showing that you have cancer. Sorry. Don't keep talking at that time. When you have said cancer, then shut up and sorry, keep quiet. Give her time to absorb. Just stop there. You have cancer. Sorry. And are you okay for me to talk about it? Be sure. You want me to call your husband? and she allows you, then she then asks you question. You have to, so if you are waiting, don't think that, oh, my minutes are going and I'll fail the station, because even they know that your minutes are going and they want you, because you are behaving so appropriately, they don't want you to fail. So she will quickly say then that if you try to rush, she will keep crying and she'll say that you are in, you don't know how to sensitively behave. So she will then keep crying. But if you kept quiet for, give her a pause, a good pause, say, I'm sorry, it's difficult. I know it's difficult. And then she will say her question then. So she will kind of open the doors for you that you, yes, talk to me. So she'll say, oh, what now, doctor? Then you can say, I can talk to you about how we go from here. Are you okay? You sure you're okay for me to talk? Yes, doctor. Yes, please tell me. Okay. So this is how it will go from here. This is how we can support. We have got an excellent team to look after you. We will be with you throughout this journey. Okay. I want you to please. We can't. We can't be you. We can't take it, we can say that this can vanish somehow, but we'll do everything to support you. So you are doing it, but if you broke the bad news first, the benefit is that rest of the time is available to deal with her questions. If you kept on faffing around here and there by history and all that, irrelevant history, not required, not needed for any there's so many things that won't be needed, but you're wasting your time because you're worried about the moment that you're going to break the bad news. You're kind of trying to hide behind that history. Please don't do that. Okay, be brave, be sensitive right from the start, and just very nicely, in a very supportive manner, explain to her. I think I'm saying that because we are used to that, doing that in our clinics, and you are worried because you're not used to dealing with that.
Yeah, correct.
Okay.
Now, one more question, Sam. Other than cancer, what all other stations where we are supposed to break this bad news first? Because some of them are not very serious as well. So, can you give some examples that in
Like
these certain cases?
If something is like, for instance, if they were expecting a pregnancy and it's absolutely not a pregnancy, then it's a full BBN. Okay, like a molar or miscarriage, or
IUFT?
ectopic, okay, or IUFT, absolutely, that is a full BBN. Okay,
Sam, if we have a high risk screening result for Downs,
that's not a
can
full
we?
BBN. That's not a full
Okay.
BBN. Okay,
Okay.
that is news of concern, but not a full
Mhm.
BBN. Okay.
And if we have an ovarian cyst, no MRI, no CT, just a young patient, nullipara, less likely to be malignancy, can we take it as a BBN? No.
Just there is a bit of a concern,
Hmm.
and this cyst is there. It doesn't look
Mhm.
like cancerous from its outlook. What are your symptoms? So you would then, your emotions will be parallel to her symptoms. How much she is bothered by this, and because she will need to undergo some investigations and some treatment for that, that is a bit just, and it's not like a BBN at
Not
all.
a BBN.
Absolutely not a BBN. Okay, you have to remember, BBN is where it's a death or imminent death of the mother or the baby. Okay, so, or the patient, gynae patient. Okay, death or imminent death or impending death like cancer. Okay, that is a BBN. Some loss that can't be prevented or can't be stopped now. So that is a BBN. Other than that, we'll come into concerns, and this, of course, if it's a cyst, just concern, but not to the level that it's Down syndrome is different, because that will be a situation she will have to deal all her life, while this cyst is not really going to be sorted in. So it's just normal kind of concern. Yeah, everybody.